Welcome, everyone. Thank you for joining us today for Safer at Home, COVID-19 and Domestic Violence. My name is Cindy Manginelli, and I'm a project coordinator with the National Healthcare for the Homeless Council, and I'm coming to you today in Nashville, Tennessee, where our central office is located. You should be able to see there in the webinar room our number for Caroline, who's providing technical support. If you're having any trouble with the webinar at all, feel free to contact her there, and she can help you out. We also have some resources there for you, which I'll mention again at the end, and we have a chat box that you're welcome to use as well. So while you read through some of our required information here, I'm going to tell you a little bit about myself. I've been at the council for 4 years, and there I visit homeless shelters across the state of Tennessee and help people who are experiencing homelessness with Medicaid and other healthcare-related issues. I also do training on issues at the intersection of homelessness and healthcare. I do a variety of different trainings across the state and some nationally, like what we're talking about today. But before I came to the council, for several years, I was a crisis counselor at a domestic violence shelter and a children's counselor at a domestic violence shelter. I worked with refugees and immigrants in a clinic as a project coordinator, and then managed a detox unit and a drug treatment center for women coming out of incarceration and women who were uninsured. So it's out of that experience today that I really want to talk to you about how the pandemic, how COVID-19 has specifically affected the households of those that we serve, and really honestly even those that we love. The conversation that we're having today would be applicable to anyone who's experiencing increased stress, increased tension, and conflict in the home as a result of what we're all going through. So what I hope to do today is to give you some really practical information, some really down-to-earth guidelines that you could use to guide a conversation with those that you're serving or really anyone that you talk to about how to keep our home safer while we really are kind of stuck at home, while we experience this isolation and quarantine, and then also what kind of conversations we can have as people emerge from this time of isolation and quarantine, having experienced things at home that were challenging and trying to kind of, where do we go from here kind of thing. So like many of you probably are experiencing here in Nashville, our city opened an emergency homeless shelter down at the fairgrounds because a lot of our shelters, social distancing was not possible. And so an emergency shelter was opened. Think about a giant gymnasium with 200 people trying to stay 6 feet apart, and that's kind of what we had going there. But I was down there a couple of weeks ago, and as you can imagine, a wide variety of people. But one woman, mid-50s, sitting on her cot and just weeping off and on all day. And she wasn't getting up for meals, and she was honestly just kind of staring at the floor. And so I went over and talked to her, and she told me her story. She'd never experienced homelessness before. She'd never been in a shelter before. This was all new for her. And she explained that she and her husband and their grown son, probably mid-20s, lived together in a small mobile home just outside of Nashville. They've had a difficult couple of years. The dad had had a heart attack and it needed a lot of heart surgery and very expensive medication. They didn't have insurance, so that had been really difficult. And then just in the last couple of years, their adult son, who lives with them, was diagnosed with bipolar disorder. And a lot of hospitalizations, a couple of suicide attempts. I mean, they'd gone through some really hard times. But in the last year, things had kind of normalized. Their son had actually enrolled in community college. He was working there at the community college. He found a support group that he really liked, medication that was working well. He joined an anger management class that he enjoyed. Her husband's health had stabilized some. Her husband was a security guard at a local mall. He was on a bowling team, had friends he kind of would hang out with at a local bar after work 2 or 3 days a week. And she was a hairstylist, worked as a hairstylist, and then had a knitting group that she was a part of with a group of friends. What she was describing to me was a family that they were right on the edge of extreme poverty. They'd actually had their utilities cut off a few times. So they come through some difficult times and were right on the edge of homelessness many times. But each individually, as they faced these they're very difficult situations as a family, they had come up with different ways of coping. If I'd asked her, what are your coping mechanisms, I don't know that she would have known how to answer that question. But the reality is all three of them had put together really strong support systems, and they had developed very healthy coping mechanisms. And so when they all came together at night at home was a safe place. It was a place they would watch TV for a while, they would go to bed, Certainly there was conflict and tension at times, but they had found ways to deal with that individually. And then COVID-19. And just like you and I and people all across the world even are experiencing, all of that was gone. All three of them lost their jobs. They were not able to purchase all of the medication that they had been purchasing before because of their limited income. But also their support systems just really literally overnight completely disappeared. They couldn't go hang out at the bar with friends. They couldn't go to knitting club. They couldn't go to school and to work. And all of the things that made them feel important, that made them feel that were affirming for them, just like that, were gone. And so they were there together in this mobile home all day, every day. And so she said, her husband just kind of shut down, just stayed in his chair and just kind of stared at the television all day, every day as the weeks kind of wore on. And her son began to become very, very agitated and very, very anxious. And she said she began to be afraid of him. He started to yell at her. He was up all night. Just tension was just growing and growing in the home. And a couple of days before she arrived there, she made everyone a sandwich. She put it down on the table. Her husband didn't even get up to touch the sandwich. And her son picked it up and threw it across the room and said, "I'm tired of this food. I'm tired of being here," and began to yell. And she said she looked at him, and he stood up, and he got in her face, and she slapped him. And she slapped him over and over and over. She said eventually he pushed her back, and they just stood staring at each other. She said, "I have never in my life slapped anyone." She was shocked. She felt guilty. She felt ashamed. And so she put a few items in a bag and went to the car and drove off. Eventually, she was directed to this shelter. And she said, tears streaming down her face, she said, if we'd gotten sick, if we'd gotten COVID, she said, we would have taken care of each other. She said, we've worked through sickness. We know how to do that. She said, we would have all loved each other. She said, but this being stuck at home, I think this is going to kill us. She said, I don't know that we'll ever recover. Unfortunately, this family is not exactly a minority in this experience. They're not the only ones experiencing this. While the details may be different, hundreds and thousands of families in our country and honestly around the world are experiencing this increased tension, this increased stress, and are finding themselves in abusive situations that they never have experienced before. If you think about the environment in your home like a pot on the stove, and there are things that we do and that happen that turn the heat up, right, and the water begins to boil. And then there are things that we do that turn the heat down. This family had lots of good practices in place that helped to turn the heat down. There were things that happened to them, most of which were beyond their control, that really turned the heat up, right? They had things that they did that turned the heat back down. But unfortunately, in this current situation with the pandemic and with the safety precautions in place, the heat was being turned up just instantaneously in a way it had never been before. This wasn't gradual. Overnight, jobs are gone. They all lost their jobs. Income's gone. And at the same time, their ability to turn the heat down is compromised. Everything that they do to turn the heat down is now impossible to do. And so we know, statistically speaking, I'm sure you've heard this, there's been a dramatic increase in reports of domestic violence all across the world, honestly. There are countries in the world, I think Turkey and South Africa and a few others, that have reported astronomical increases in the number of deaths in the home because of domestic violence. Here in Tennessee, we have counties that are reporting as much as a 100% increase in the number of calls that they're receiving reporting domestic violence. So domestic violence call centers, police stations are all receiving more calls than they've ever received historically, and the severity of their calls has increased. So the kinds of violence that we're seeing in the home is worse than we're typically seeing. So we're seeing a similar spike in calls to suicide hotlines, mental health crisis services. Across the board, we know that this, whether it's the actual virus or the safety precautions put in place, we absolutely know that there's a mental health crisis and a domestic violence crisis and a substance abuse crisis that is certainly boiling under the surface of this larger crisis with the pandemic. That's actually the largest thing that I hear in reports that I'm receiving from shelters across the state and that we're hearing across the country is the number of people who are relapsing as the support services put in place to support support those who are trying to maintain their sobriety have also been compromised. At the same time, the way law enforcement and the way our judicial system handles domestic violence has been altered. Many police stations across the country, if you call and report domestic violence, the police will not come into your home because of social distancing guidelines. They will require everyone to come outside. So you can imagine if you're in a situation where you've reached that point that you're calling the police, and then to know we're going to have to rehash what's going on in front of our entire community. A lot of people are more hesitant to call the police as that awareness is spread, and then the ability to get an order of protection or some of those security measures that we've had in place are also much harder to get now, and some people may erroneously believe you're not able to do that at all. So all of this combined together, we can see that absolutely this is a time where domestic violence is at a significant increase, and that there are people experiencing abuse in the home who may never have experienced that before, and certainly those who've been in abusive homes may be experiencing a level of severity that they never have before. So we want to be, as those who are service providers, we want to be those who know how to have this conversation, who know how to guide our clients or those that we serve through this conversation, not afraid to bring it up. We want to be fully cognizant of the fact that a lot of people are living in really difficult home situations. We want to be able to bring it up, and we want to be able to talk about it in an informed way. And that's what we're going to do today. We're going to identify and mitigate sources of stress in the home. So we're going to talk about what it would look like to guide that conversation. We're going to safety plan for conflict in the home. And then we're going to talk about worst case scenario, and we're going to have to actually leave the home. This has actually become a dangerous, volatile situation. What does that look like, and how can we guide people preparing for even that worst case scenario? So this is not what we're saying. This is going to be really important. What we're not saying is that all violence can be prevented if you have the right plan. We certainly would not want to give that message to those that we're communicating to. It may sound like, well, if you say the right things and if you identify the right triggers and you come up, then there'll never be violence in the home. You'll never have another fight. And so if there is a fight, you must have done something wrong. You must not have followed the recipe. That is not what we're saying. We would not want to communicate that. The reality is sometimes violence is unavoidable. If you're living with someone with antisocial personality disorder and they're a psychopath, and everything you do may actually feed to violence. There are certainly situations where nothing that we're going to talk about would help except for maybe the safety planning part. So I don't want to leave anyone with that impression that I'm giving here a recipe for family harmony that eradicate all violence, and we don't want to communicate those to those we're serving. Also, we don't want to say, what we're going to be talking about a lot, what we're going to be saying is how to avoid conflict. And not all conflict is unhealthy and should be avoided. What we're doing is that we're recognizing that there are times where conflict is unhealthy and times where we're really not prepared to navigate conflict in a way that's profitable. So while we're going to be talking a lot about avoiding conflict, I certainly don't want to give the impression that all conflict is unhealthy and that if you have a home where there's never conflict and never disagreement, that's the goal. That's not what I'm saying. What we're talking about today is if you realize you're in a situation where you're trying to avoid conflict or that we really can't navigate conflict right now, what do we do? And so we're going to just follow with me and assume that when I'm talking about conflict, I'm talking about unhealthy conflict. So one of the things that makes this time particularly tricky is the reality that a lot of us process crisis very differently. Even if you are not directly affected by COVID-19 itself, you don't have the virus, you don't know anyone who has the virus, even if that's the case, we're all being affected by the safety precautions put in place. So many people have lost their jobs. Many people have been told in one way or another, you are non-essential. And so for a lot of people, just being told that, just facing the reality that the world goes on, if I sit at home for a month, that's a loss of power, a loss of a sense of control, a loss of significance, a loss of affirmation. We're all being bombarded by information about the virus, whether we're directly impacted by it or not. And so there is a sense in which we're all sort of walking through different levels of crisis. And so that in and of itself can make for a lot of stress in the home, because the reality is we all process crisis differently. I've been a crisis counselor for a long time, and I've walked with families through just terrible situations. But if you think about a situation like someone's house burning down, we know that when a married couple or when a couple living together goes through a crisis like the loss of a child or the traumatic loss of a home, about 80 to 90% of those couples will divorce within 5 years of that crisis. The primary contributing factor to that is that they process that crisis differently. So one person wants to talk about it all the time, wants to remember, wants to set up memorials, and the other person doesn't want to talk about it at all and wants to forget it and move on. And then in the spectrum in between, you've got everyone kind of bouncing back in between. The same thing can happen right now with COVID-19. You may have one person in the home who wants to watch all the news, who wants to gather all the information, who wants to check the websites, who wants to compare facts, who wants to talk about it. And that makes them feel powerful and in control and a little bit more safe. And then you'll have other people right now who don't want to talk about it at all, right? They don't want to watch the news. They don't want to compare the stories. They don't want to see all the paradox. They just want to move on, right? And so when you have people in the home who feel very safe and very powerful and very in control in different ways, that in and of itself leads to a lot of conflict. When the person I'm living with is coping in a way that creates more anxiety for me, that leads to tension and conflict. And so that's a big part of what we're facing right now, just that. If in every other way you have a perfect relationship and total harmony, just that, the fact that most people don't process a crisis exactly the same way, moment by moment, is a big part of what's going on right now. And so recognizing this is what makes me feel safe and what makes you feel safe, and how can we find a middle ground there, can be a big part of reducing at least the surface level conflict that we're feeling around the pandemic right now. So that's an easy thing to walk people through. How are you dealing with this issue, COVID-19, and how is the person in your home or the people in your home, how are they dealing with that? That can be a good place to start. So let's talk about, what I want to talk about now is disarming landmines. So we want to talk about if I could float over my home and get sort of this big, broad view of my home, right? So this is the conversation that I'm having, that I'm guiding my clients through, or that I'm guiding my friends through, or those I'm providing services to. Let's take a big, broad look at your home. What are the landmines? What are the places, the conversations, the topics, the activities that that explode, right? That if we go here, there's going to be an explosion. People are going to be hurt. There's going to be conflict. And what we're hoping to do here is to address where conflict begins and not so much just have to look. At the end, we're going to talk about safety planning for when the conflict has become abusive, it's become dangerous, I'm actually hurting people now, or people are hurting me. Let's back this way up and look at where does the conflict begin. Where are the landmines in my home? And we're going to look at all of these topics from two different perspectives. First of all, for the individual. So for the individual that I'm talking to, so I've worded that here as for me, when I look at me, and then when I look at my household. So this is a conversation you could have with a 12-year-old, or this is who may have very little influence in their home. You can still help them to determine and to be mindful about, how am I being triggered and how am I contributing to conflict in the home? Again, not how you're causing conflict, not how all the conflict in the home is your fault, but what can you do in the home? What impact do you have in the home to help reduce stress and tension? And what can you do to reduce stress and tension and the potential for conflict in yourself? So if I'm talking to the head of household, that may look very different than if I'm talking to a 10-year-old. But they all may have the potential to address potential conflict in themselves and then to contribute to an environment that is not as stressed and not stressful and as tense in the home at large. So what can I do for me? What can I do for the household? So let's look first at conversations. What are the topics? If we discuss this, it almost always leads to a fight. What we're doing here when we're not angry, when we're not in the middle of a fight, is we're stepping back and we're remembering when these fights start, what's happening. Violence or even conflict are very often ritualistic. There are very often the same things, the same kinds of things happen and lead to the same kinds of conflicts and the same kinds of violent results. So if we think about conflict like a path, right? Like if I'm walking into the woods and I've got a path in front of me, there are certain steps that may always lead me down that path. So I begin thinking a certain way, we begin acting a certain way, and then we are headlong on this path that hopefully doesn't end in violence and disaster, right? So what we want to do is, what are the first few steps on that path? And can we avoid it? Can we stay off the path, right? So keeping in mind, we're looking back at the times there's been conflict, at the times there's been violence, at the times there's even just been really nasty arguments. What were we talking about? Are there certain topics that we just need to put on the shelf right now? I know a lot of people are thinking, hey, now we've got all this time together. We really need to tackle some of these topics that we never want to talk about or that are hard or that we never have time to talk about. And the reality is this may not be the time to do that. There may, in fact, need to be certain topics that we say, not in an unhealthy way, not in a scary way, but we're going to put this on the shelf. This is not a healthy time for us to address these topics. Things like our budget, our future plan, sex, our family relationships, things like that. Are there just topics like that that very often lead to conflict, and we just need to put them away for right now? What are those topics that typically end in a fight? What are the locations in your home where you typically get in a fight? A lot of people will say when we're cleaning up the kitchen or when we're all sitting around the dinner table. What are those places in the home where we typically, when we have a fight, we are typically here doing this, talking about this. That's what we want to look for. And then are there ways that we can reorder lives? Are there ways that we can restructure things, maybe just temporarily, to avoid those topics, those locations, and those activities? I was talking to a family. You know, we love playing board games. We've always played games, but right now we're realizing that those games are very often ending in fights. So we're not playing games right now. Are there activities like that that you need to just put aside? We usually have this person do the chores. We're realizing when they do the chores, it's resulting in a fight, so they're not doing chores right now. We don't want to live like that forever. That wouldn't be healthy. But for right now, what are the topics, people, location, places, what are the things that I can change, and then do I have influence in the family that we can work on change together, right? So we want to identify some of those first. What are those landmines? Also disarming the landmines, we want to look at what are the feelings that lead to conflict. And again, I'm looking at this in myself, or I'm helping the individual I'm talking to look at that in themselves. And then in the household at large, to whatever degree I'm able to influence the household at large, right? When we think about domestic violence, we very, very often just directly jump into anger management. We're going to talk about anger management, right? And that's important. Anger management is a valuable tool. But it can also be important to realize there are a lot of emotions that lead up to anger. Anger isn't typically, for most people, their knee-jerk reaction. First, before they got angry, they were feeling some of these other emotions. And so if I can help someone to understand what those underlying emotions are and to potentially address or divert from those underlying emotions before they become anger, then I may be able to help someone avoid conflict in the home. Okay? So fear and sadness are two of those emotions. If I feel afraid or if I feel sad, and those are certainly emotions that a lot of people are feeling right now around the pandemic. Those are emotions that a lot of people feel anyway. Those are unpleasant emotions that we can often turn into anger, or that we can turn on someone that we love or care about, or someone that we're just trying to live with when we're feeling those. So what am I feeling? Being very mindful, what am I feeling? What are those that I live with? What are they feeling? And is that something we can talk about? Now, I realize that I'm describing here a very healthy situation, right, where we can all sit around and talk about our feelings. That may be unrealistic, but at least the individual that you're talking to may be able to do that and may be able to find creative ways to do that in the home. Loss is a big one. We talked about this at the beginning of the webinar, how so many people today are experiencing loss. Just the loss that one feels when they're told you're not essential. it is a loss to not be able to go where you normally go, to not be able to go to the park, or even to not be able to go down to the grocery store and buy the things you would normally buy and walk down the aisle the way you would normally walk down the aisle. If you're like me, even just running to the store has become really complicated. But I'm not able to purchase the things I would normally purchase. My routine has changed, and that's a loss. For a lot of people, it is a profound loss. And so a lot of people at this time are feeling uniquely powerless and uniquely out of control. In a lot of ways, we have less freedom now than we've ever had. We're feeling, for many of us, the first time this real lack of freedom. And so that's a loss. And so that loss, that emptiness, the pain of that, the feelings of inadequacy, the loss of feelings of affirmation can cause me to become angry and turn on other people. Loneliness and boredom are also big contributing factors to domestic violence, and this is something we talk about, and of course all of these are things that we talk about when we talk about domestic violence. But uniquely now, there are people experiencing loneliness and boredom who usually have very full lives, like the woman I met at the shelter. She normally deals with loneliness and boredom by going out and knitting with her friends, or going to a Bible study, or going to work and talking to people. She right now is experiencing a unique level of loneliness and boredom. And when we are lonely, we will very often turn to those that we feel should be providing companionship to us, right? I shouldn't be lonely. I'm here with you. Why am I still lonely? Why can't you entertain me, or why can't you make me feel all the ways I need to feel? And so loneliness and boredom will very often result in conflict. So being mindful of that, okay, I'm beginning to feel lonely, or I have felt lonely, or I know that my teenage daughter is feeling lonely. We're all experiencing boredom. What can I do? What, if anything, can I do to mitigate that, to make that more bearable, as opposed to just turning on each other, right, and letting that become anger, letting all that build up in me? So as we think about those different landmines, what can we do at home to cope? And there are things we can do at home to cope, but brainstorming with those that we serve around coping mechanisms in the home. What does that look like? And that will be very different for different people. But what can we come up with? Can we cook? Can we play games? Can we sew or paint or read or watch television? Or what can we do at home to cope? And to be very intentional about identifying those things. They may be things that we would normally never do. I would never work a jigsaw puzzle. It's not my thing. Do I need to pull that out now and say, all right, kids, here we go? Because we've got to come up with ways to cope given the environment that we're in. We've got to accept the reality of the environment that we're in. Acceptance is going to be a big part of dealing with all those triggering emotions that we just talked about. I've got to accept where I'm at, and then I've got to figure out, given that this is our reality, what can we do to cope? And then what brings peace in our home? When I look at the times when we were not fighting, when I looked at the times that we were getting along really well, what were we doing? What were we talking about? Where were we? And can we do that more? How do I capitalize on that, right? Strengths-based approach. What are the strengths we have going for us? And being really intentional about, let's use that to our advantage. Let's make this work for us. So what can I do as an individual in the home? I'm brainstorming with this individual that I'm talking to. What can I do? What can you do? And then what can we do as a group, whether that's just 2 of us living at home or 15 of us living at home? Given all these landmines, what can we do to diminish that? What can we do to turn the heat down? What do we do that makes it go up, and what can I do to make it go down? One of the biggest things that we can do, if you're in the domestic violence world at all and you've worked with people with domestic violence, you know that a big trigger for domestic violence is times where people are building up a lot of energy and have no way of expressing that energy. We know that nationally broadcasted athletic events are a time when we see an increase in domestic violence in our country. So the Super Bowl is one of the biggest nights for reports of domestic violence, and there's some thought that that's because people are letting energy build up. They're getting very, very excited, and yet they're sitting. And so that energy explodes on those that I'm living with. And so that can be something that's happening now too, as people really are isolated and stuck in their home, is that my mental energy, my emotional energy, even my physical energy is building up. And the normal ways that I would pop that release valve, right, that I would gradually let the air out of that balloon have all been compromised. So not letting that energy build up. What can we do to expend energy? What kinds of physical things can we do so that just the reality of being stuck in one place doesn't result in increased tension in the home? So we've talked about identifying some of those landmines, identifying causes and triggers. Now let's talk about what do we do with the reality? If we know the reality is we are going to fight, okay? Those are all good things. All of those will hopefully help reduce the likelihood of conflict, will hopefully help reduce tension and stress in the home. But if we just know the reality is they're going to be fights, nothing is going to alleviate that fact, then what do we do around keeping that conflict as healthy as possible, as safe as possible? Of course, we all have arguments, but probably for most of us, not all of our arguments end in someone feeling abused, in someone actually being harmed. Hopefully our arguments end with some kind of resolution, and that if there were things said that we wish we hadn't said, then there's an apology, but most of our arguments don't end with someone bleeding, hopefully, right? That's what we want to try to avoid. If we know the reality is there is going to be conflict, what can we do to set parameters around that conflict to keep it as safe as possible? One is to really think about picking your battles. You may have been in situations, I know I have, where it seemed like, man, we just fought all day, whether it's at my workplace or in a relationship. What can we do to avoid that? And picking your battles is a big part of that. Do I have to win this one? Do we have to finish talking about this? Or for the sake of the greater good, can I let this go? Can I sidestep this? I'm not talking about being a victim. I'm not talking about trying to keep everyone happy all the time and never standing up for yourself. That's not at all what I'm talking about. What I am talking about is just saying, for the sake of the relationship, do we have to do this now? And for whatever part you have, can I pick my battles? Again, I'm talking about the conversation you would be having with a client or someone you're providing services to. And then identifying warning signs, helping your clients identify warning signs. What does it feel like when you're about to lose control? If we can identify that feeling, then it may be that we can put practices, ways of thinking into place that immediately turn the heat down. What does it feel like in me when I'm about to boil over and it is going down? What does it feel like in my body? What does my heart do? Do I get sweaty? Do I stand up? Do I get louder? What do I do when I'm about to lose control? What do I begin thinking? What are the things I begin hearing in my head? Again, conflict, violence is typically ritualistic. There's typically a pattern. And so when I lose control, it typically there are going to be warning signs that are there, present almost every time. So helping someone identify those warning signs in themselves. What could you do in that moment as you feel yourself beginning to lose control? And then what does it look like in the other people in my household when they are losing control? And in most people, there will be a tell or there will be signs. Does she start to yell? Does she start to pace? Does she begin flinging things around? Does his face get red? Does he begin to use profanity? Does he go and get a drink? What are the signs in those in my household they're losing control? And can I begin to recognize those signs and do something at that point to turn the heat down? Again, I'm not responsible for anyone else's behavior. I can't make them act a certain way. I can't control them. But can I do things that would reduce the likelihood of conflict and of violence? Talking through that with those you are assisting. What are those warning signs? And then is it possible to create a neutral zone? And this, again, would be something that would be much easier to do in a fairly healthy household, although I have worked with families with long-term history of domestic violence who have been able to successfully do this. And a neutral zone just means when I go to this place or when you go to this place, the fight is over. That's it. This is a no-fight zone. It doesn't mean that I don't want to talk to you or that I don't love you or that we can never talk about this, but it means right in this moment, I'm losing control. And so I have a place that's been designated, way before the conflict began. That's my neutral zone. And if I'm losing control, I can go here, and it's over. The fight's over, for right now at least. And ideally, everyone in your home has the right to a neutral zone. Your children, anyone can say, when I go here, this means I can't talk about it anymore. I'm going to lose control. And so identifying that for each member of the household can be a way to keep a simple conflict or a simple argument from escalating to the point that something terrible happens. All right, so let's talk about, again, if we know there's going to be a fight, we know that's going to be the reality, how, again, more ways that we can keep the conflict safe as possible, right, as predictable as possible. So one of those factors is to talk with those you're serving about where conflict takes place and making conflict as safe as possible for everyone in the home, okay? So there are places in your home where conflict is much more likely to be dangerous, where people are much more likely to get hurt. Those places are typically places where everything around you is hard. So if we have a big argument in the kitchen and my husband gets angry and throws something, that's going to be very different than if we have the exact same argument in the living room and he just grabs something and throws it, right? There's a big difference between a throw pillow landing at my feet and a blender landing at my feet. And so that's kind of what we're talking about here, is we can kind of do certain things that ensure that this doesn't, or not that ensure, but we can do certain things to keep this fight as safe as possible. So the kitchen, the bathroom, the basement, the garage, even the car or any place where we are stuck in a really confined area, those are places where it is just physically more dangerous to be angry, to be furious. Whereas if I'm in a wide open space, if I'm in a room where most things are soft, then if someone pushes me or if I just lose it and push someone or someone throws something, it's less likely to result in injury. And it's less likely to be so scary. So just being really intentional, if possible, about this is where we fight, and this is just a place where we never fight. We just walk out if we realize this is going to be a heated argument. And then for everyone else who's in the home, what does it look like for them to feel safe while there's a conflict? So the people who aren't actually involved in the conflict, what can we do to help them feel safe? Saying to your children, again, this is a conversation we're having with those we provide services to, saying to the children, you know what, Mommy and Daddy are going to fight. I wish we didn't, but it does happen sometimes. I wish we could promise you that we were never going to fight again. We don't think we can. You guys fight. The reality is we're probably going to have arguments too. When we have an argument, you guys go to the playroom and turn on the TV or whatever that looks like, whatever that place is. You guys go outside. Again, there's a big difference between a heated argument and a heated argument where a child rushes in to try to resolve it. And so what can we do to keep these heated arguments as safe as possible for everyone in the house? And so what we really talked about then is what we really encourage people to think through is before a fight, during a fight, and after a fight. What are the ways that we can keep the heat turned down as much as possible? And then what can we do to keep everyone as safe as possible, even if it boils over? Okay, so before, during, and after are what you would ideally be walking your clients through. What we're doing here is we're just setting boundaries for conflict. Even setting boundaries for something we wish never happened. And so that's what a lot of people never do, is they never want to sit down and admit we are going to have a big fight. This is probably going to happen again. They don't want to set those boundaries. A boundary boundaries make a huge difference in families experiencing domestic violence. If you've worked with people who've experienced domestic violence, then you probably had those thoughts where the person who comes to you for help just says, oh, I just don't think it will ever happen again. I hope it never happens again. I wish it had never happened, and I hope it never happens again. Well, let's set something concrete there, right? If this happens, we're going to get help. For this woman that I met at the shelter, slapping her son, for her, she hit a boundary there. she decided, I will never, ever slap my son again. I can't be the kind of person who slaps her son. And so she left. She didn't just say, I hope I don't do that again. She said, something's got to change, right? She's going to go for help, in essence, is what she's hopefully eventually going to do. And so having those boundaries in place. And unfortunately, we can't control those boundaries for those that we serve. And that's another just, really heartbreaking thing about working with people who are in domestic violence situations, is sometimes they set those boundaries where I would not set them. I have had so many clients who would say, I'm going to stay there with him even though he does this, this, and this. And but if he ever tries to kill me or whatever, a boundary that's much broader than what I would prefer or than what I feel comfortable with. But we have to honor the boundaries. These are adults. We're not talking here about child abuse. We're talking about conflict amongst adults. We have to let them set those boundaries and honor them. But at least establishing a boundary somewhere helps to ensure that this isn't something that just keeps getting worse and worse and worse and worse and never finds an ending point. If this happens, we're going to do something. We're going to take steps, and even being able to identify what are those steps. All right, so we've talked about, set a lot of groundwork there for hopefully being able to avoid conflict, unhealthy conflict, for hopefully never even going down that path. Now we've talked about, if we know we're headed down that path, we know that conflict is inevitable, what can we do to make it as safe a path as possible? Now what we want to talk about is what if we are headed headlong into violence, into abuse, into someone is going to get hurt, and we've got to do something. So we're going to talk about what safety planning looks like with those that we're talking to who are experiencing domestic violence. Okay? That's probably one of the things that's made the safety precautions around COVID-19 and COVID-19 probably one of the things that makes that most dangerous for people living in violent homes is the real sense of, boy, now I really am stuck. And of course we're hearing stories of abusers all across the country who are telling their victims, where are you going to go? Right? A feeling I have a unique sense of control over you because we're all supposed to stay at home. And there have been all kinds of just terrible stories of how people have been manipulated in their own home because of the safety precautions put in place, or because of the threat of the virus itself, right? If you leave, am I going to get sick? Am I going to make my parents sick? All of that has made this a time where people really do feel like I can't do anything now. I can't do anything now because I'm stuck at home, right? So that's the reality. Is for most people, they do still have safe options, and that's what we would really want to emphasize to people. Whenever you safety plan with someone in a domestic violence situation, what you're looking for is, what are the safe people, what are the safe places? And so a lot of people have decided, now I have no safe people, I have no safe places. And that will result in more of a feeling of panic and more of a feeling of being trapped. All of that will lead to a lot of unhealthy things. And for most people, it's not true. Okay? If I have someone in my life who's experiencing domestic violence, I would still want to hear from them. I would be willing to risk a lot for them. I imagine that you have people in your life like that too. So there are still safe people out there. And of course, there are still a lot of resources out there. So helping people to identify, all right, who are the safe people now? Maybe it's a different list than you had before, and what are the safe places now? And helping them to identify that. The reality is those are still in existence. A big safety technique that we always use among those struggling with domestic violence is the idea of a safety password. And the safety password idea is just that I have someone in my life, and I say to them, if I call you and I use this word or I use this phrase, that means I need help. And it would be decided ideally beforehand what kind of help I would like you to offer. So if I call you and I ask you how your dog is feeling, that means I need you to come get me, or that means I need you to call the police, or that means I need you to call and check on me, whatever. That would be decided in advance. But that is a technique we've used, hundreds and hundreds of times, is the idea of a safety password. If I text you the letter X over and over, that means I need you to come get me. And that is always a good practice to have in place with those experiencing domestic violence. When we're working with families where where there's violence in the home, of course, what people always say is, why don't they just call the police? And if that's the go-to thing you suggest when you're talking to someone, very often you're going to be shut down. And a lot of people in domestic violence situations do not ask for help because they do not want to see their partner or whoever the person in the home is, their parent, their elderly parent, their teenage child, whatever, they don't want to see that person get arrested. And so for that reason, a lot of people don't reach out and ask for help because they don't want law enforcement to be involved. This is what makes domestic violence, intimate partner violence, family violence so complicated, is typically the violence is occurring with someone you deeply love and someone you want to protect and someone you want to maintain relationship with. So we have to keep that in mind when we're having these conversations. If they do want law enforcement involved, that's fine. Most of us know how to contact law enforcement in our communities. If they don't, then we have to be able to accept that reality and brainstorm around other options, or they're just not going to come to us for help anymore, right? So we have to be careful how we suggest the involvement of law enforcement and whether or not that's the best option. And then on just the most practical level, any good safety plan is going to include an emergency bag. I answered a domestic violence hotline for years, and the number one reason I would hear over and over why people did not leave their abuser was, I don't have my stuff. He's got my medicine, or what's he going to do to my cat? People, pets, and belongings were the primary barriers that kept people from getting help. So helping someone think through that. All right, if there's a terrible, terrible fight and you feel like your life is in danger, what would you want to have with you? What would you have to have with you in order to safely leave or to feel like you could leave? That's typically going to include things like keys, medication, medication for children, documentation, important phone numbers, birth certificate, social security card, all that kind of stuff. Ideally, having a bag packed with all of that, and then a plan of this is what I would do with my dog, or being able to come to some resolution of I guess I would have to leave my dog, whatever. But being able, I don't mean whatever like in a very callous way. I realize that's a terrible decision to have to walk someone through. But talking about those things now, okay, well, what would you do so that that person's not standing in a dangerous situation trying to make those decisions? And then I think it's really important that we as service providers be prepared for the aftermath of this. When I spoke to the woman in the shelter, her comment to me was, do you think I'll ever be able to go back home? And so in her mind, she had crossed some sort of threshold and life would never be the same again. That's probably not true. That relationship can probably be restored. She would probably be welcomed back home with open arms, honestly. But she, of course, has just been setting in all this guilt and shame, and domestic violence is a situation where there's just a unique kind of shame that people can feel in that situation. So being able to, as people, again, sort of emerge from isolation and quarantine, being aware of the fact that many have spent time, months, weeks, in a home where terrible things were said and maybe terrible things were done. How can we help people regain that sense of trust and to reestablish home as a safe place? Being prepared to have conversations like the ones we just had to avoid future conflict. Being able to normalize, like we talked at the very beginning, the reality that this was really hard. And so people did things they wouldn't normally do and said things they wouldn't normally say. But being aware that that's happened is probably going to be most important. Being able to say, we recognize that you probably come out of you probably emerged from a situation where you experienced a lot of things at home that didn't feel safe. How can I help you feel safe at home again? And some of what we've talked about today will be relevant there. There'll be more that we have to put into that conversation, but I think we all need to be prepared for that reality, that domestic violence, mental health, recovery, all of this is going to be a part of helping people get back to normal life as we see them, once again, back in our offices, back in our support groups, back in our meetings, being prepared for that reality. I know we've covered a lot of information today very quickly. Hopefully this has given you some really good talking points and some ideas about how to move forward. Hopefully there will be things that you can talk through as a staff and some tools that you can use as we begin to, hopefully as we begin to move out of this time of isolation and quarantine. I would love to hear more from you. We're not going to do a question and answer time here at the end of the session, but I would love to hear more from you. What are you seeing? What are you experiencing with those that you talk to? And what have you found to be helpful? As you think about re-engaging people, what are some of the tools that you plan to use? We would love to hear more about that. Here at the National Healthcare for the Homeless Council, we are really intending to, and in actual reality are, serving as a resource for people all over the country, even somewhat all over the world, as they kind of navigate this pandemic, and then our hope is to continue to do that. So we would love to hear what's been working for you, what you've tried, and then also what you've experienced as you've been moving through this. So my email address is here. Again, you can respond to me directly. I am going to go through any comments that we received too, and I plan to respond to those. You'll also see here on our resource page that we have a number of coffee chats coming up. Our coffee chats are a forum where we have people presenting information, but you also have the opportunity to chat with those who are present. So it's kind of like a, let's only call it that, a coffee chat, kind of like a big room where we have some experts, but also just want to have people be able to chat and hear from each other. So those dates are on here, May 1st, May 5th, and May 8th, and you can go to the resource pod there and find the links to register for those. You would need to register, and we can send you the link. But we invite you to join us for those as sort of the ongoing conversation about COVID-19. Thank you for joining us today, and we look forward to hearing from you. Goodbye.